back, everybody, to the Medicare and More show. Today, we're going to talk about a variety of subjects. We've got about 5 different subjects we're lined up to talk about. And just to reintroduce ourselves, my name is Kerry Faria. I'm the Assistant Director of the Central Massachusetts SHINE program. And my cohort.
My name is Ed Roth. I'm the Region Director for the Central Mass SHINE program, and we're happy to be back today. There's a number of things we want to talk about. In particular, I think there's one thing we want to discuss, and that's an opportunity for folks if they have a Medicare Advantage plan, like a Tufts or Fallon or a Blue Cross Blue Shield, HMO, or PPO, they can change their plan from January 1st to February 14th each year. Kerry, you want to talk a little bit about that, how that might happen?
Sure. So if somebody has a Medicare Advantage plan, as I was talking about, and you've decided it just isn't fitting your needs anymore, maybe you're finding it to be expensive or whatever the circumstances are, maybe you don't have a doctor in the network anymore, this is the window of time of which you can get out of that plan. So as Ed was mentioning, it's January 1st through February 14th of every single year, but there are some rules around that. So if you do have a Medicare Advantage plan and you want to get out of it, what happens is the person, the beneficiary, will revert to having original Medicare. And you have no other options but to have original Medicare. And so if you have original Medicare and you want additional insurance, because again, Medicare covers 80%, there's 20% that will need to be paid for, then we would want to probably have a discussion with you about Medigaps and also drug plans. So that would be something we'd encourage you to give us a call and talk about that so we can talk about your options. But there's some things during this window of time that you cannot do. Would you like to expound on that?
Yeah, during this window of time, you cannot go from the Medicare health plan you have now to another Medicare health plan. And it has to be that you need to go from your health plan to original Medicare. And in order to kick that off, you have to pick up a Medicare Part D plan. And we certainly will help you with that if that's what you want to do. But the only thing you can do now is where we want to emphasize is you can go from your health plan to original Medicare, which is Medicare A and B would be a primary, and then you could pick up a supplement plan or a Medigap plan, and then also a Medicare Part D plan to cover your medications. So this would give you your full coverage, okay, that you had, and it's a little, that kind of coverage is a little bit more comprehensive. So again, if you're finding that that Medicare health plan isn't working out, it's not working for you, this is the time of the year when you can make that change. And we encourage you to call us, and we'll help you through the process if you'd like us to. Also, want to talk just a little bit about a program that's going on now. If you have a Medicare Part D plan, you just got a new Medicare Part D plan, and you're finding that one of your medications is not covered by the new Part D plan you have, they have what they call a transitional refill. So if you have a medication that's not covered by your new Part D plan, okay, you can get a 30-day supply of that medication through a transitional refill. Now, some of our pharmacies may not know about that, so you're going to have to point that out to them, okay? And there are some restrictions on that as well. Kerry, you want to talk about the restrictions?
Yes, if someone has it has to be a drug that somebody's currently taking. So if somebody's currently taking a drug, they've enrolled into a new drug plan for 2015, and you're finding that, wow, you didn't realize it, but the drug that you've always been on, now it's not even covered by the new drug plan in 2015. That's where that transitional refill would help you out. But this is a one-time, it is a 30-day supply, as Ed had mentioned. So that's all it can be used for. So it gives you a window of time of which you can contact your doctor and you can make some other arrangement for some other drug that is covered by your plan. But it has to be a drug that you're already taking, and it can't be for a different drug, and it can't be for a drug that's not even on a Medicare formulary, for example. So there are some restrictions around that you have to be a little careful with. But again, it's just a window of time to give you a little breathing room so you can get set up on your new plan and get set up on drugs that are covered by your new plan. So it's just to help you out in between.
And this will also cover if you get into, again, a drug plan, and the drug you were taking under the new plan, it may have restrictions or prior authorizations. So that 30-day, that transition refill will help you with that as well. It gives you, as we said, an opportunity to contact your doctor, come up with a different medication that would meet your needs, and get a prescription for that medication and run it through your pharmacy for the drug plan, so you'll be able to get an appropriate medication on a regular basis. So these are a couple of tools that can help you at this time of the year to get you through this new process, the new year starting out. Kerry, what else do we have for this portion of the program?
Another thing that we want to touch on briefly is the fact that we're also during an open enrollment period. And this is an open enrollment for Medicare Part B. So if a person never took Medicare Part B for whatever reason, this is the time period which a person can now get into a Medicare B. So the window of time is always January 1st through November 31st, of which someone would want to get into Medicare Part B. Medicare Part A, usually you can get into whatever time of the year you want to. That usually has an open enrollment period year-round if you don't have to pay for it. If your Medicare is free, don't worry, you can get into that any time of year. But B, this is the time. It only is open during this one window of the year. So again, January, February, March 31st, that is the time of which somebody would want to contact the Social Security Administration, because they're the ones who start Part B. And then if you're approved for it, the coverage wouldn't actually start until July 1st. So that's going to also make it a little interesting in making some insurance choices. So that is something to keep in mind. And again, if there's any questions about how that functions or how to do that, we're here to help you figure that out. So please, you can give us a call.
And remember, you have to have Medicare Parts A and B in order to pick up any other supplementary coverage. The supplementary coverage works. It supplements Medicare A and B, and that's how it works. So if you don't have that A and B, you won't be able to get any supplementary coverage. You could get a Medicare Part D plan, a Medicare drug plan for your medications with just Part A. But again, to get more comprehensive medical coverage at your hospitals and your physicians, you need to have minimally both the Medicare Part A or Part B to build upon. So we want to emphasize that to make sure you remember that. So that is the general enrollment period for Medicare Part B. It runs from January 1st each year to March 31st, with the coverage to begin on July 1st of the year. Okay, so we just want to emphasize that. Now, as I recall, the last program we did, we had Kathy Devine from Prescription Advantage in with Kerry, and they went over the Prescription Advantage program, and it was a great program. I think we got a lot of information out, and in particular, we got out how Prescription Advantage can help folks with their Part D coverage, the coverage they get for their medications, and how it can supplement that where it doesn't cost them as much money. And that's very important to us. That's what we like to see. We like to save people a few dollars, because all of these programs can be very expensive. Now, what we want to get into in today's program somewhat are a couple of other programs that can save you money. So we're going to talk about extra help from Social Security, and we're going to talk about Medicare savings programs in the next few minutes to enlighten you a little bit about these programs. So hopefully, if you're eligible, you can avail yourself of the opportunity. And so let's talk a little bit about extra help if we can, Kerry.
Extra Help is a federal program, actually. It comes through the federal government. It also is called the Low Income Subsidy. So if you hear that term Extra Help, or if you hear the term Low Income Subsidy, it really means the same thing. Now, Extra Help or Low Income Subsidy specifically helps a person with paying for a drug plan, and it does nothing else. But what it will do is it will help you pay for the premium, so that's the monthly cost of the plan. It will help also so that you don't have to pay for the deductible. A lot of drug plans have an annual deductible, about $320. It does away with that, so you don't have to pay for that. And it locks in on the co-pays of the drugs. I should go back and say, though, that it depends on there are two levels to extra help. So there's quite a low income level and there's kind of an upper level. So it may not pay for the deductible entirely. It depends on where your income falls in there. But there is relief built into that. But again, it's also going to help on the co-pays of the drugs. So again, it depends on where your income falls as to how much subsidy you're going to receive. So it does those things to help somebody pay for a drug plan through Medicare, but also you can have extra help if you have a Medicare Advantage plan. So if you're finding that the cost of your drugs are being a little prohibitive, or you're just finding it's a little expensive, maybe extra help is something for you. So what's going to happen, though, is you've got to apply through the Social Security Administration. Again, so there's two ways to do that. The Social Security Administration actually has a website, and you can do the application online. So that's one way to do it if you like to use the computer. You can actually call Social Security, and Social Security will take your information over the phone, and they do the work for you. But if you're going to do it in that way, you need to send in all of your income information and your asset information into Social Security, because otherwise they have no idea what you're receiving for income. So you will have to send that in. And a third way is obviously a paper application. So those are still available. You can fill out a paper application, and again, when you submit that paper application into Social Security, you're going to have to send in all copies of all of your paperwork into Social Security so they have a way to process your application. So there's three manners of which you can apply. And again, it's really helpful. It helps you pay on your medications, but there are income limits and there's some asset limits.
There are, and a couple of points I do want to make is also if you enrolled in a Part D plan late and you got a late enrollment penalty, extra help will take care of that penalty for you, so you won't have to pay that penalty. And also, it does not, if you have extra help, it's not going to cover or it's not going to subsidize you for medications that are not on the drug plan's formulary or excluded medications. Medicare does exclude some medications, not a lot, but they do exclude some medications. So it won't cover, it won't subsidize non-formulary medications of the drug plan or excluded medications. Now, if again we mentioned some income guidelines, and the income guidelines, the income has got to be below 150% of the federal poverty level, and currently that level it's fairly, it's not generous, but it's not as low as you may think it might be to qualify for extra help, and that is if your income, if you're single, is $1,479 a month. That's your gross income, okay, before taxes and your Medicare premium. If it's $1,475 if you're single, and if you're a couple, if you're married, that can be $1,986 a month. Okay, so if your income is at or below that level, and your assets are below $13,640 if you're single, or $27,250 if you're a couple, you can qualify for this program. Now, as Kerry said, there's two levels. There's two different levels, and what we encourage the people to do is to be sure and apply. Okay, you can't get any level if you don't apply. Okay, so if you meet these income guidelines, and by the way, though these income guidelines do change, the income guideline is going to change in March. Okay, the income guideline will go up a little bit in March. Okay, and in the asset guidelines, they just went up this past couple of weeks ago. So you're going to look at these asset guidelines, and they'll be the same throughout the year. And the assets, and what's not counted in this too, and it's a good deal, is your primary residence isn't covered, and one vehicle and life insurance policies are not covered. With a lot of programs, you'll see that the cash value of a life insurance policy is counted as an asset. It used to be with this program, but they changed it. They changed it a couple of years ago, so it's no longer covered. So again, the program can be very helpful. So we encourage folks, if they're close to these levels of income, to give the program a try. And Social Security will let you know exactly where you fit in the program. They'll let you know whether you'd be a level 1 or a level 2. And again, the benefits are great. And also, there's another thing that you can get with this. If you're having a difficult time with your Part B program, you can get a special enrollment, okay? Anytime, okay? If you want to change your Part D program, you can change it up to once a month. So again, a great program. And also, finally, you'll be asked on an application if you'd like Social Security to submit that information to the state on your behalf. And that would make you eligible for what we call a Medicare savings program, okay? And we're going to go over those programs. And those programs also are great programs to help folks. So Kerry's going to talk a little bit about them and go into them a little bit. And hopefully, again, we can see if we can fit into one of those programs for you. Again, this is about you. It's about saving a few dollars.
The Medicare Savings Program is also a really nice program. And that also has a second name, because most of these programs have two names, because one is on a state level and one is on a federal level. So the federal level is called the Medicare Savings Program. The state name for this particular program is called the Mass Health Buy-In. And sometimes people get confused. They're like, I have to buy something? I thought this was supposed to help me. So no, you don't have to buy anything. That's just what it's called. And what it is it's a program where the state actually will help you purchase your Medicare Part B. So Medicare Part B for the majority of individuals is $104.90 per month. So instead of you paying for that, the state pays for that. So what happens is the state will contact, if you're approved and the state says yes, you qualify, the state actually contacts the Social Security Administration, and the Social Security Administration stops taking the Part B premium out of your check. And instead, the state subsidizes that. So what happens though is sometimes that takes a while to happen because Social Security is a big government agency. So it's a little slow sometimes in responding. So the state will inform Social Security that from your date of application, from when you were approved, is your start date of when that subsidy begins. So what would happen is maybe, for example, it's June, okay? You were approved in June, now you get a letter from the state saying you're approved for the buy-in in June. But it takes maybe until like September for Social Security to stop taking that Medicare Part B premium out of your check. Well, what will happen then is that Social Security will reimburse you back to June. So they'll actually send you a check for all of those months of your Part B premium back to the beginning of June. So you will get that money back in your pocket, and that's a very helpful thing. So again, that means your check, your Social Security check, is going to be increased by the $104.90. So, but there's three different levels. Again, we're talking about levels within the same program. So the Mass Health Buy-in program has three different levels. One level is called Qualified Medicare Beneficiary. And what that means is you're the kind of the lowest income level in that particular program. So you get some special benefits from the buy-in program because of your income level. So not only will the state pay for your Medicare Part B premium, you also qualify for the low-income subsidy or the extra help on your drugs, but now the state will also offer to act like your secondary insurance to Medicare. That's pretty big. So Medicare would be your primary payer, and Mass Health would be the secondary payer. So what that means is you don't need to buy any other insurance. You have 100% coverage between the Medicare and what Mass Health provides you for coverage. So that is a really big issue. And again, you don't have to have secondary insurance. The key to that, if you're going to use that type of insurance, is you do have to make sure that your doctors accept Mass Health benefits and then you can use that. The other thing you would want to do is you don't need any other insurance. So if you do have a Medicare Advantage plan, or if you have a Medigap, you can terminate those policies. You don't need them anymore. So that is one level of the buy-in. Then there's kind of a middle ground level called SLMB, or SMLBY. And SLMB is where, again, the state will pay for your Medicare Part B premium, and it will also pay for, subsidize your drugs. You'll get the LIS, or the extra help. So it does that. And then there's a third level called QI1, which also pays for your Part B premium of the $104.90 and also gets you the extra help on the drugs. So some people are like, sounds like SLMB and QIMB, those two higher levels, are kind of sort of the same thing. They are, except that QI1, the highest level there, has a little higher income guideline, so it leaves somebody a little more wiggle room on the income than it does under SLMB. And the other thing is that QMB, QIMB, and SLMB are both protected parts of this law. So there would need to be a legislative change for it to lose funding. So those two parts of this program are always stable. It's not going to go anywhere. But QI1, which is the higher income bracket, is always kind of subject to whether or not it's going to be funded or not. So that's why it's kind of on the outskirts a little bit, because it could be terminated. It hasn't for years. It's been around for years, been stable for years, but we just like people to be aware of that just in case.
Good, Kerry. And with the QIMB, and I want to. This is a good program, and another reason why. Okay, somebody can have low income, and they can send in a Mass Health application. A Mass Health application is required for most of these programs, but you can send in a Mass Health application, and your assets might be too high to qualify for Mass Health standard. But with this program, the assets can be a little bit higher. Now, for Mass Health, the asset level is $2,000. You can only have $2,000 in the bank. But with the QIMB, with the Medicare programs, these Medicare programs, you can have more than that. For instance, to qualify for QIMB, you must complete a full Mass Health application. Your income must be at or below $993 if you're single and $1,331 if you're a couple, and that's basically 100% of the federal poverty level. But your assets can be at or below $17,160 if you're single and $10,750 if you're a couple. So you can get basically pretty much Mass Health standard benefits, okay, at a higher asset level. So again, it's a good program if folks are struggling, and as Kerry pointed out, we have to make sure that your doctors do take the Mass Health in payment. And so if they do, you're in pretty good shape because you're going to be able to use this Mass Health as your supplement. Now, on the SLMB and the QI1, again, you could either complete a full Mass Health application or a Mass Health buy-in application. And income for these programs has to be at or below $1,331 if you're single, and if you're married, it's got to be at or below $1,790. Okay, and the asset levels are the same for both programs. So the asset levels are higher than you normally see for Mass Health programs. And again, the income levels for these programs do change each year in March. And another good thing about these programs is that if you qualify, you will also be approved for full extra help with your prescription drug costs, okay? So again, these are very beneficial programs, and we would like to see as many people enrolled in them as we can see, and we're willing to help folks if they call the office, need a little help with an application, they'd like an application. All of these applications are available on our website, and again, we mentioned our website last time, but our web address is www.shinema.org. And we have a resources page here that will take you to all of these applications and all of these outfits. And you can probably fill out an application online for some of them. So again, good applications, good information that we want to bring forward. And Kerry, if you can explain the case, I think we got a case up on the screen that will explain to folks how the program works.
Sure. For example, we've got a case example of an individual who has an income of $1,100 per month, and that's his gross, and he has about $5,000 in cash in all of his bank accounts. So if this individual fills out a Mass Health application, he would be approved to have his Part B premium paid for. So again, the $104.90 be paid for in his behalf, so he'd see his check increase by the $104.90. And he would also receive full extra help, which would help pay for his drug plan premium. He would not have a deductible, and he would have set co-pays on his drugs. So that would be a huge help to this particular person. So just to give you an idea on, based on what your income is, what kind of benefits you receive. And just quickly, a couple of points I would like to mention too, is if you do have, if you qualify for the buy-in program and you never took Medicare Part B, the Mass Health buy-in program can jumpstart Part B for you, so you can turn it on. So that's kind of a nice thing too. That's very helpful. And depending on what someone's coverage level is, would depend on what application we recommend that they would fill out. We might actually recommend somebody filling out a full Mass Health application because we want to have them have the full benefits. So depends on that. So again, we've got some great programs that somebody can avail themselves to. And if there's any question at all about whether or not somebody qualifies, my mother qualifies, my aunt qualifies, I qualify, there are any other hidden pieces to it that we just don't know about, or how can I use this, feel free to give us a call. That's why we're here. We're free. I think we mentioned that way in the beginning in the first program, but it's always helpful to note that we are free, we're nonprofit, we're subsidized by the government to do this for you. So we're here for you. That's what we do. So please take advantage of us.
Yeah, it's important. Give us a call. And another thing I want to emphasize, you're watching these programs, hopefully in a local community cable show. If you see something you're interested in, you want to talk to you want to have a talk to a family member, or your son or your daughter, brother, brother-in-law, whoever, grandson, have them take a look at us. Again, you go to our website. All of the programs are on our website, okay? You just go to that Shine, www.shine.ma.org, and you can get our programs. They're all on the website, and you can review what we said. So all of this information is up there. It's available for folks to review and take a look at. So if you missed something, you're a little confused by something, you can call us or have your kids give us a call. Good to see you. Good to be back. We'll see you next month.